Drug abuse is a serious and persistent issue in the Philippines, with widespread use of methamphetamine or shabu being particularly concerning. The problem has contributed to rising levels of crime, violence, and public health issue, significantly impacting communities and families. The government has responded with a combination of law enforcement measures and rehabilitation programs through challenges such as stigmatization of drug users, limited rehabilitation resources, and inconsistent support for long-term recovery. Effort continue to hide progress. The situation remains complex, requiring comprehensive and sustainable solutions that balance legal, social, and medical approaches. In statistical analysis, the Dangerous Drug Board or the DDB reported on Monday, December 2, 2024, a 16.6% decline in illegal drug use in the Philippines, as revealed by the 2023 National Household Survey on the Patterns and Trends of Drug Abuse. According to DDB Executive Director Earl P. Saavedra, the survey showed a reduction in current drug use prevalence from 2.05% in 2019 to 1.7% in 2023, reflecting a 16.6% drop. In terms of the estimated population, that equates to an 11.7% decrease, with the number of current drug users declining from 1.675 million in 2019 to 1.479 million in 2023. Saavedra emphasized that the findings affirm the effectiveness of the government's health and human rights-based approach in addressing drug-related issues, offering hope and framework for sustainable progress. The Katatagan kontra Droga sa Komunidad or KKDK, this program focuses on community-based drug treatment using culturally relevant approaches to reduce drug abuse. A case study evaluating KKDK involved 355 participants, with 203 completing the program. The results showed that the participants exhibit improved coping skills, better family relationship, and a reduction in substance use behavior. So the Padeza de Esperanza, it is located in Masbate. This program follows a therapeutic community approach using non-medical detoxification, combined with super spiritual growth and family involvement. A case study conducted with Fazenda de Esperanza showed that participants who stayed engaged with aftercare programs, including ongoing counseling and community involvement, reported a higher rate of long-term sobriety. Next is the Buhay ng Pag-asa, Hope of Life, or the Hope of Life program. The Buhay ng Pag-asa program emphasizes residential care, work therapy, and spiritual guidance. A case study of participants who entered the program found that those who had consistent family involvement and aftercare support showed improvements in emotional well-being and integration into their communities. So next is the Oplan Tokhang, or it is launched by the Philippine National Police. Oplan Tokhang encourages voluntarily surrender of drug users through house visits. In case study examining the program's impact, many of the individuals who surrendered for rehabilitation found have through Barangay Drug Rehabilitation Center. These centers provide outpatient counseling and reintegration support.
First, the government agencies. Here, the Dangerous Drug Board or DDB belongs. So this develops and implements national anti-drug policies and programs. Next is the Philippine Drug Enforcement Agency or PDEA. Leads operations against drug trafficking and monitors compliance with drug-related laws. And the last one is the Department of Health or DOH. Oversees treatment and rehabilitation services, including residential and community-based programs. Second, local government units or LGUs. LGUs implement grassroots initiatives, including community-based drug rehabilitation or CBDR programs, community education campaigns, and livelihood support for recovering drug users. The third one is the non-governmental organizations or the NGOs. Organizations such as organizations such as USAID's Renew Health and the Philippine Anti-Drug Campaign Advocates or PADCA actively engage in delivering technical support for treatment programs, raising awareness, and training community leaders to manage interventions effectively. The fourth one is the faith-based organizations. Churches and religious groups provide moral and psychological support to individuals in rehabilitation. They also offer integration services and counseling to families impacted by drug abuse. The fifth one is the law enforcement agencies. So under the law enforcement agencies, we have first, the Philippine National Police or PNP. So combats drug abuse through community policing initiatives and enforcement of anti-drug laws. And the second one is the National Bureau of Investigation or NBI, targets high-level drug syndicates and traffickers. The sixth one is the healthcare providers. Accredited hospitals and professionals deliver detoxification services, counseling, and medical support for those undergoing rehabilitation. And the last one is educational institutions. Schools participate in prevention campaigns like Barkada Contra Droga, involving students and educators in raising awareness and preventing youth involvement in drug use. First one is rehabilitation facilities. DOH accredited residential treatment centers and community wellness and development centers. Facilities providing evidence-based therapies such as cognitive behavioral therapy or CBT and livelihood training. The second one is the community-based drug rehabilitation or the CBDR. Accessible at the barangay level, CBDR programs cater to lower to moderate risk drug users, integrating family support and mental health services. So the third one is the helpliness and digital platforms. The National Center for Mental Health Helpline offers confidential counseling for individuals struggling with substance abuse. E-learning tools and online resources are available for healthcare providers and community leaders. The fourth one is the capacity building initiatives. Programs like GCAS, Interlab, train professionals on effective relapse prevention and treatment models. USAID Renew Health trains community facilitators to deliver locally relevant interventions. And the last one is the funding and international partnerships. Government and international bodies, including USAID and GCA, provide financial and technical support to enhance existing programs and develop new strategies.
First, leverage media channels. Utilize television, local radio, and social media to spread awareness about the dangers of drug abuse. Creative, relatable content can be shared through popular platforms like Facebook, YouTube, and TikTok, giving to engage diverse age groups. Host public forums, organize events in communities where health experts, recovering addicts, and law enforcement officers can discuss the effects of drugs and available help. These face-to-face interactions build trust and open conversation in places where drug abuse is most prevalent, helping to break the stigma around seeking help. Incorporate prevention into school curricula. Schools can integrate drug education into their regular curriculum, focusing on the harmful effects of drugs and promoting healthy lifestyles. Teachers and school staff can be trained to spot early signs of drug use and offer immediate support. Extracurricular activities. Schools can organize after-school programs focused on sports, arts, and leadership development. Offering students positive outlets and keeping them away from drugs. Collaborations with local NGOs can provide funding and resources to keep this program sustainable, offering an alternative to drug use for at-risk youth. The barangay-based education conduct regular educational sessions in barangays, villages, focusing on families and young people. Local leaders, in collaboration with health professionals, can help workshops that provide information on drug abuse and how to prevent it. Mobile outreach units implement mobile outreach units that travel to underserved areas, providing drug education, counseling, and rehabilitation information. These units, staffed with healthcare providers and social workers, can help bridge the gap in areas that lack access to treatment facilities. Community support groups create local support networks involving former addicts, families, and community leaders. These groups can offer ongoing support and provide a safe space for individuals in recovery, fostering a culture of reintegration and mutual support. First is peer education programs, training young people to lead anti-drug initiatives in schools and communities. Peer-to-peer programs are highly effective in encouraging behavior change, as young people tend to listen to their peers more than adults. These youth leaders can share their personal stories and offer support to others, both online and offline. Last, the life skills training. Establish programs that teach youth critical life skills such as decision making, problem solving, and conflict resolution. These skills equip young people to resist peer pressure and make healthier choices, reducing the risk of falling into drug use.
Improve equipment and facilities, providing law enforcement with updated technology training and necessary resources is crucial for effective drug enforcement. This includes the provision of modern drug testing kits, surveillance systems, and data management tools. Allocating more funds to rehabilitation and treatment centers will also help law enforcement focus on long-term solutions rather than just punitive measures. Regional and international cooperation. Expanding efforts to target drug trafficking at a regional and international level is crucial. Collaboration with neighboring countries and international organizations such as United Nations Office on Drugs and Crime can help identify and disrupt transnational drug trafficking networks. Crime mapping and predictive policy. The use of technology such as geographic information system and predictive analytics tools can significantly enhance law enforcement's ability to combat drug abuse. By analyzing patterns in drug-related crimes, authorities can deploy resources more effectively, targeting high-risk areas before problems escalate. Surveillance and social media monitoring. In addition to traditional surveillance methods, law enforcement agencies can adopt advanced monitoring tools to track drug activity online. Social media platforms and messaging apps have become key channels for illicit drugs transactions, making them valuable resources for intelligence gathering. By using digital monitoring tools, law enforcement can identify drug sales, distribution networks, and high-risk individuals in real time, leading to more rapid interventions. Law enforcement training programs. Regulating training and capacity building for police officers should focus on modern drug enforcement strategies, human rights considerations, and intelligence gathering techniques, ensuring that officers are well versed in handling drug-related crimes with professionalism and care can reduce instances of corruption and abuse. Specialized anti-drug units. Establishing or enhancing specialized anti-drug units that are well trained in dealing with drug syndicates and addiction issues is essential. These units can focus on high-profile cases, large-scale drug busts, and community-based interventions, while other officers focus on regular patrols and crime prevention. Comprehensive drug use data system. Developing and maintaining robust databases that track trends and drug use, trafficking routes, and law enforcement activities will help agencies tailor their responses more effectively. This system can facilitate collaboration between various government agencies, ensuring that resources are allocated where most needed. research on drug abuse patterns. Encouraging academic and government research into merging drug abuse patterns, including the rise of synthetic drugs and new trafficking methods, is essential. This will help law enforcement stay ahead of trends and develop targeted strategies to combat emerging threats.
Timely access to care. Many drug users face barriers to accessing treatment due to distance or lack of resources. To overcome these challenges, mobile counseling units can be deployed to reach underserved or remote areas. These units can offer counseling, support groups, and initial assessment for drug users, helping reduce stigma and providing immediate access to care. Collaboration with local business and NGOs. Effective rehabilitation requires resources that many government facilities lack. By establishing partnership with local businesses, NGOs, and community groups, rehabilitation centers can offer more comprehensive services. For instance, business can provide vocational training or job placement for recovering individuals, while NGOs can help fund additional counseling services or peer support programs. Telemedicine and online counseling. With the rise of digital platforms, telemedicine offers a viable solution for providing medical and psychological support, offering online counseling session, virtual support groups, and medical consultation can significantly expand access to treatment, especially for individuals in rural areas, of those who cannot afford in-person visit. Culturally relevant interventions. Drug rehabilitation programs should be designed to meet the specific cultural needs of Filipino drug users. This program can incorporate local tradition, community values, and family dynamics to ensure they resonate with the participants. For instance, family-centered approaches that involve educating family members about addiction and recovery can significantly improve rehabilitation outcomes by providing strong support network for individuals during the recovery process. Post-rehabilitation support to ensure long-term recovery and prevent relapse. It is critical to provide job readiness and financial literacy programs. These programs can teach drug users practical skills such as resume writing, interview techniques, and basic financial management, preparing them to re-entry into the workforce. Ongoing check-ins in supports. Recovery doesn't end after formal rehabilitation. It is a lifelong process. Regular aftercare services such as follow-up counseling, peer support groups, and periodic health checkups help individuals stay on track.
Coordinated efforts in schools and neighborhoods. Schools should work closely with local governments and community organizations to offer comprehensive education on the dangers of drug abuse. Programs can include interactive workshops, open discussions, and local mentorship opportunities that emphasize decision-making, resistance skills, and positive behavior. Reaching a wide audience via media. Local radio, TV, and social media platforms are effective in spreading awareness about drug abuse risks. Public service announcements and informational campaigns that include real stories, statistics, and expert advice can normalize the conversation around drug prevention. So first, we have empowering young leaders. Peer education programs where young individuals educate their peers about the consequences of drug use have shown to be particularly effective. Youth-led initiatives foster a sense of ownership and responsibility in the prevention process, enabling them to reach a broader audience with messages that are more relatable. So, prevention in the workplace. Employers can contribute to drug abuse prevention by implementing workplace drug awareness programs. These programs can offer education about the science of drug abuse, stress the importance of healthy lifestyles, and provide resources like counseling services and employee assistance programs. So, bringing information to remote areas. To reach marginalized or rural communities that may not have access to formal drug education programs, mobile outreach units can travel to local neighborhoods. These units, which may include counselors and prevention specialists, can offer educational materials, presentations, and resources for treatment, ensuring that even hard-to-reach populations are educated about the dangers of drug abuse and how they can access help. Combining resources for maximum impact. Governments, non-governmental organizations, and local community groups should collaborate to create unified drug prevention initiatives. By pooling resources and expertise, these groups can launch large-scale campaigns that target the specific issues, such as prescription of drug abuse or the risk of methamphetamine use, and offer a variety of prevention methods from informational pamphlets to support group meetings and community health fairs. Focusing on family dynamics. Many drug abuse cases are influenced by family dynamics and the environment in which individuals grow up. Family-focused prevention programs provide education and counseling to help parents recognize signs of drug abuse, offer strategies for maintaining open communication, and develop healthy family coping mechanisms. These programs help build a supportive home environment that can deter individuals from turning to drugs. By employing a combination of education, media outreach, peer support, workplace initiatives, and community engagement, these programs offer a realistic and applicable approach to combating drug abuse.